This is Plant-Based Briefing, Autoimmune Disease, Genes, Infection, Environment, and Gut, Part 1 by Thomas Campbell, MD at nutritionstudies.org. I'm Marian Erickson. This is the curated content plant-based podcast where I narrate articles on plant-based and vegan living with permission in about 10 minutes or less every weekday. And today's article is longer than that, so it's a two-parter. I'll read Part 1 today and then come back for Part 2 tomorrow. And now let's get to today's plant-based briefing. Autoimmune Disease, Genes, Infection, Environment, and Gut, Part 1 by Thomas Campbell, MD at nutritionstudies.org. You may be familiar with the term autoimmune, given the popular media's increasing attention to chronic inflammation and autoimmune disease. Autoimmune means that the body has an immune reaction to substances naturally present in the body. In other words, the immune system attacks the self. This can happen in most parts of the body. Accordingly, more than 80 autoimmune diseases have been named and described. Many autoimmune diseases are rare and not very extensively researched. Table 1 below lists a few of the more common examples. Table 1, sample of autoimmune diseases out of more than 80. In the thyroid, there's Hashimoto thyroiditis and Graves' disease. In the joints and skin, there's psoriasis, vitiligo, rheumatoid arthritis, and ankylosing spondylitis. In the central nervous system, there's multiple sclerosis. In the pancreas, type 1 diabetes. And in the gastrointestinal tract, Crohn's disease, ulcerative colitis, and celiac disease. Though many individual conditions are very rare, autoimmune diseases are collectively quite common, affecting about 7 to 10% of the population, with women being more commonly afflicted. These diseases can be extremely difficult to diagnose and often present with vague symptoms like fatigue, odd pains, or skin rashes. Given the prevalence, the lack of scientific understanding, and the vague symptoms, autoimmune diseases have become something of a catch-all in the public mind, and it seems that the prevalence of autoimmune disease is increasing. If an illness goes undiagnosed and is composed of a collection of non-specific symptoms, many people are quick to wonder whether an autoimmune disease might be the cause. Autoimmune disease is complicated, extraordinarily complicated. According to my reading of the literature, several intertwined factors may affect risk. 1. Genes. 2. Infections. 3. Environment, including diet, sun exposure, and tobacco use. And 4. Gut health, including the bacteria living in your intestine and their activity. Let's go through each of these briefly to illustrate their importance. Genes. I've known many patients, particularly patients with family members who were afflicted, who believed autoimmune disease is nearly 100% genetic. It turns out that genes matter a great deal for some autoimmune diseases, but are less important for others. It seems that whenever more genetic research is done for any one disease, more regions of our genes are found to be involved in risk. Human leukocyte antigens, or HLA genes, are particularly prominent in autoimmune diseases as they're involved in the body being able to distinguish the self from foreign invaders. For example, all celiac patients have one of 2 HLA genes, though many other genes may be involved. Table 2 shows summary data from identical twin studies. Identical twins are useful to study because they have exactly the same genes. The term concordance in this context refers to the probability that a twin will have a disease given that their twin also has the disease. Table 2, autoimmune concordance among identical twins. For type 1 diabetes, the concordance is 13 to 47%. For multiple sclerosis, 0 to 50%. Celiac disease, 60 to 75%. Autoimmune thyroid disease, 17 to 22%. Psoriasis, 35 to 64%, Crohn's disease, 20 to 50%, ulcerative colitis, 6 to 18%, lupus, 11 to 40%, rheumatoid arthritis, 0 to 21%, and ankylosing spondylitis, 50 to 75%. Some conditions like celiac disease and ankylosing spondylitis seem to have very strong genetic components, but the risk of getting many other autoimmune conditions like multiple sclerosis, lupus, rheumatoid arthritis, ulcerative colitis, and type 1 diabetes is clearly affected by something other than genes. In other words, for many of these autoimmune conditions, having high-risk genes may be a necessary but not sufficient reason for a person to get the disease. It's something more than just genes. Infections. Certain infections are linked to autoimmune diseases. This should come as no surprise. Consider what your body does in response to infections. It revs up the immune system to fight the invaders. In some cases, infections may actually lower the risk of autoimmune disease. In other cases, they may cause autoimmune disease. How could they be protective? One theory is that growing up in a more and more sterile environment, increasingly common in modern life, is not good for the immune system. In simplistic terms, it's almost as if the immune system needs some practice to get it right. In experiments involving mice bred to have high risk of developing type 1 diabetes, researchers can prevent the disease by exposing the mice to infections early in life. Infections can be damaging, too. Several autoimmune diseases have been linked to specific infections. Sometimes it seems that chronic infection and inflammation from a viral or bacterial invader can precipitate immune system confusion at some point, triggering the start of the autoimmune process. People who have been exposed to Epstein-Barr virus, or EBV, which causes mono, have a higher rate of multiple sclerosis. Those infected with EBV in adolescence or later in life have a 30 times higher risk of multiple sclerosis compared with those who are never infected. This is called molecular mimicry. The molecules mimic each other in a sense. For example, the bacteria that causes strep throat can lead to immune system cross-reaction with the heart muscle, causing rheumatic fever. This is a main reason why we give antibiotics for strep throat. Similarly, ankylosing spondylitis has been linked to Klebsiella pneumoniae, Guillain-Barré, to Campylobacter jejuni. Dozens of links have been discovered between various autoimmune conditions and viruses or bacteria. Environment. If the genetic component is important and infections frequently play a role, are autoimmune diseases basically just luck of the draw illnesses? No, that's clearly not the whole picture based on data related to other environmental exposures. Rates of multiple sclerosis, or MS, a disease that damages nerve sheaths, vary widely throughout the world. When I tell you that the rate of MS is higher the farther away a population is from the equator, how do you make sense of that? How about the fact that those born in November have a slightly lower rate of MS, and those born in May have a slightly higher risk than would be expected by random chance? How are these connected? Does cold weather or some other seasonal factor somehow cause MS? We know that if migrants from a high-risk area move to a low-risk area, their risk becomes lower than that of their homeland population. We obviously have to consider more than genes and viruses. Some other environmental exposure matters. By environmental exposure, I mean food, exercise, tobacco, weather, environmental chemicals, X-rays, or basically anything to which we're exposed. In the mystery of why MS is more common the farther from the equator you go, the answer is related to vitamin D. Lower vitamin D levels are linked to a higher risk of MS and a higher risk of exacerbations if you already have the illness. People farther from the equator have lower vitamin D levels, and babies born in the northern hemisphere in November compared to May have been in utero when their mom is more likely to have had better vitamin D status. We make vitamin D when our skin is exposed to sunlight, so you can see how being farther away from the equator might be linked to disease risk. We also know now that vitamin D is involved in immune system function. Importantly, vitamin D supplements have not been shown to be helpful for multiple sclerosis. You can't take a nutrient supplement and get the same benefit for chronic disease. This principle has proven to be true many times in many studies. You just listened to Autoimmune Disease, Genes, Infection, Environment, and Gut, Part 1 by Dr. Thomas Campbell at nutritionstudies.org. And I'm your host, Marian Erickson. Tune in tomorrow for the second half of this episode, where you'll hear about nutrition and gut health and how they relate to autoimmune disease, and you'll hear some related episodes you might want to check out in addition. So please share this episode with anyone who might benefit, and thanks for listening.